Hello, my name is Jim Kennedy. I'm a partner in Wargrave General Practice, and this is an update on Wednesday, the 14th of April, just to update all our patients and the population we serve in Wargrave and the surrounding areas on what is happening in the practice over the last few weeks and the next few weeks. So, firstly, to just deal with the COVID vaccination situation. I'm delighted to say we've offered at least twice, and in most cases 3 or 4 times, the vaccination to all our population aged above 50 and all vulnerable adults under the age of 50. And the uptake has been fantastic, so thank you very much indeed for that. We're getting uptake rates in the high 90%. They may still, despite all our hunting, be a few people out there that haven't heard about the COVID vaccination, but please, we would strongly encourage everyone who's in the target groups to come for vaccination. The estimation nationally is that when we vaccinate everybody above the age of 50 and all the vulnerable adults under the age of 50, we will have targeted the population that accounts for 99% of the deaths from COVID. Now, it is still possible for people outside those groups to get ill with COVID and sometimes even quite ill, but thankfully the risk of mortality is extremely small. We have just been informed in the last 12 hours or so overnight that we can now start to progress into the 45 to 50 age group. And indeed, we have a clinic booked this Friday, the 16th of April, at the fire station, where we will be inviting 45 to 50-year-olds to that clinic, in addition to all the second doses that have already been booked in. So you may well, if you're in that target group, receive a text from us today or tomorrow, which will come to your mobile number, and you just click on that link and it will take you straight into the booking system for the clinic. If you miss this week, don't panic. There will be weekly clinics over the next 4 or 5 weeks. The supply situation, as you know nationally, April is relatively small numbers of new dosages, but we have guaranteed supply for second dose vaccines. And as we've said previously, you will get a text or a notification in week 10 for your vaccination in week 11. So you should be getting your jab in your arm in week 11. If you have not heard from us by week 10, then please do get in contact with us. Remember, it is vital that you update your mobile phone numbers and your email addresses to us at the practice, especially if you've moved or changed your phones recently or anything like that. And we look forward very much to having that information so that we can contact you and keep in touch. There's some very good information now on the practice website, which gives not just when the clinics are happening, but also a very useful calculator that lists the weeks when we gave first doses, and then what the linked second dose week would be. So if you look up the week you got your first dose in, you'll be able to see immediately which week your second dose is due. I think that is the main thing for the COVID vaccinations at the moment. The one thing I would ask people, please, is please don't be ringing the practice if you are before your 10th week, because obviously that just clogs up the telephone lines, unless there is a very, very good reason why your course needs to be accelerated. And there are a few people who are, for instance, going through chemotherapy or have had big surgery or other interventions scheduled, who need to get the second jab slightly early And we can accommodate that, but there needs to be good rationale behind it, obviously. The reason why we're not just giving it early to everybody is the Joint Committee on Vaccinations and Immunisations is very clear that you get the maximum benefit if you wait for the 11th to 12th week, in that you get a better kick up in your immunity levels, but also it makes it last much, much longer. Thank you very much indeed for listening, and we look forward to seeing you at our vaccination clinics.